What's up, guys? In dentistry, our patients see us as either a hero or a bum. Patients either love you or they hate you. I'm gonna give you the exact patient management framework I use to protect my mental health while building a thriving practice. This includes scripts, boundary setting techniques, and prevention strategies you can implement immediately. Here's what dental school doesn't prepare you for. And this is honestly a very brutal truth and a very brutal realization that you have once you start to practice. See, you can do the perfect root canal and the patient still has pain. Or they come back in 2 weeks and the tooth blows up. There's a periapical radiolucency. You can do a flawless crown prep that results in sensitivity. And patients will blame you for these normal healing responses that our body has. Your clinical excellence doesn't necessarily guarantee you patient satisfaction. See, I learned this the hard way when a patient called me incompetent and that I didn't know what I was doing. After a textbook crown preparation resulted into a little bit of post-op sensitivity, and the patient told me this never happened until you touched the tooth. See, it was this moment when I realized that patient psychology affects their perception of the quality work you do than the actual clinical quality work. Let me show you how to handle these situations professionally. See, I made a mental shift. What did I do wrong to how can I make this right and prevent this in the future? See, it's not about accepting blame. It's about focusing on solutions. Complication happens as you're practicing. Each patient is different. Their body responds different. Some patients are just going to be naturally difficult. Your job is to solve problems and be a professional, not to be perfect. So I had this patient, she was a 52-year-old patient. She had an inlay done 20, 30 years ago in California. It came out, I re-cemented it, and it came out again. Why? Because the tooth structure was undermined. She lost tooth structure and that inlay was no longer retentive. So the proper course of action was to do a full coverage crown. Crown was placed perfectly, margins were great, contact was great, occlusion was great. And her response is that I ruined her tooth, that it never hurt before I touched it, and why couldn't I just re-cement the inlay? And did I use the right cement? She even went on further to say things like the dentistry was flunky and, it doesn't make sense how her inlay lasted 20 years and this is causing her sensitivity, and that she was questioning basically my competence as a provider. So she was saying all this on the phone call to the front desk. And here's my response protocol that I took. Step one is I called the patient personally. I told her, look, Michelle, I understand your frustration. In 10 to 20% of patients, there is post-op sensitivity after a crown prep. It happens. There was a lot of decay in your tooth and it's normal. But if it is lingering and it's bothering you, we will take the proper course of action and I will have my endodontist take a look at it. Then she proceeded to say, oh, she spent all this money. When I look back, her insurance actually paid all of it. She didn't pay anything. But essentially, she was alluding to the fact that she feel like she wasted her money. And you will have this. Patients will have what's called buyer's remorse, right? They will get the crown done, an implant done, and feel like they shouldn't have spent the money, and they will find a million things, they'll try to find one thing that's wrong with it and complain and complain and complain to try to get their money back. It's a real thing that happens. Or they may just have genuine regret about doing the procedure altogether. So despite me offering the solutions, being very respectful for her, I also on the phone call, said, look, Michelle, I get you're frustrated, but I'm here to help you, okay? So please don't use these derogatory terms, speak to me with respect. I respect you. I am just trying to help you, right? You came to me with a problem. I'm here to help you, okay? We're gonna get this sorted out. So that right there, she automatically started to kind of get a little bit warmer and say, oh, I apologize. And, I didn't mean to come off like that, right? People, unfortunately, they see you sometimes as like their punching bag and they have other things stressing them out and they just want to take it out on you. So you can't always take things personal and you always have to create a boundary for yourself, right? You're a human. You deserve to be treated with respect. And anyone that crosses that line is not just someone you don't want as a patient, but someone that you should stand up to. So she started to hear me out right after I basically told her she was kind of being disrespectful. And I said, look, I will get you to the root canal specialist. He will look at the tooth, okay? If there's anything wrong with it, if he feels that you need a root canal, we will get it done. And I discussed with my office manager and I decided to look, the money that she spent on the crown, just put it towards the root canal, basically refund it and credit her towards the root canal, right? And this is something that you should do, right? To protect your mental health, to protect your team's morale, the culture in your practice, and to just also, you know, cover your ass, right? Like, it's not worth it, okay? Just let it go. You're gonna get these difficult patients. It's better to refund them the money, document that you explained to the patient what happened, document that they were being disrespectful, document that you will refund them, etc., etc. So now, how do we prevent this, right? We don't want to be in this situation, okay? Prevention is the best way to manage these patients. So what I like to do now is every time I recommend a crown, I always tell the patient, look, crown is the best option here. If you need to figure out ways how to tell a patient they need a crown, you can go look at my other video. But you tell them, look, the crown is the best option here. What we do see though in a small percentage of patients is that, you know, they have a post-op sensitivity from doing the crown. And in those cases, we would have them referred to the endodontist, okay? But we're gonna do everything in our power to prevent that. We're gonna use a lot of water. We're gonna reduce as little tooth structure as possible. And we will get you numb when we cement the crown. Just make them comfortable, right? But you are setting the expectation. That's the most important thing you can do as a provider, is always set realistic expectations, right? Always under promise and over deliver. So guys, just remember, right? You're gonna have a difficult patient, and unfortunately the negative experiences are what stay with us. You could see 200 patients in a week and that one patient will stick with you and it'll stay in the back of your mind. Let it go, right? If you have a page at your office where there's reviews, go read some good reviews that you have yourself. You'll notice that for every bad experience, there's 10 to 20 good experiences that patients have with you. There's patients that love you, and don't take complications personally. Do not lose sleep over this, right? Understand that as long as you are doing the right thing, as long as you are being ethical and trying your best, that's all we can do, right? We can just try our best to help our patients. Things don't always go right, and we try our best to make things right when they go wrong, right? If the patient is being disrespectful, if they look down on you, that's them. Okay, they don't understand what it's like to be in your shoes, and they're the ones that have the bad spirit and bad energy, and it's not you, right? You did nothing wrong. Any good, normal person would understand the complications, would understand, and will notice you caring and trying to make things right, and they'll appreciate it. So when I started to implement this expectation setting, I started encountering less and less of these irate, aggressive patients. I began to be a lot more at peace, sleep better at night, and not take things so personal. So setting expectations is just one component of building a successful dental career, right? There's a complete system: being clinically efficient, communication frameworks, understanding the business of dentistry, strategizing on how to advance yourself in this field. So if you want any of that like comprehensive training, if you enjoy my videos, please hit the link in my description and you can get direct access to me by joining my school community. And there is a section, a class there where you can book a 90-minute strategy call, where we have a 90-minute call. We discuss where you're currently at, where you want to go, how you're going to get there. I answer any questions. You also get a week access to me to ask me any questions. And then from that 90-minute call, we will build out a complete plan over the course of months and have you follow that plan to your end destination. So if that sounds interesting to you, just hit the link down below, join that school community, and I will see you guys there. Thank you so much for watching. Please like, comment, subscribe, and I will see you guys in the next video. Peace.